In this video, I'm going to demonstrate the AP open mouth projection and lateral projection for the atlas and axis.
The patient should be positioned erect in AP position. Unless trauma, the patient will be supine. The patient's shoulders should be at equal distances from the image receptor to avoid rotation. Slightly adjust the patient's head just so the mastoid tip will be perpendicular to the image receptor. And at the last instant, instruct the patient to open their mouth as wide as possible. If patient is instructed to open the mouth, only the lower jaw moves, and keep the tongue in the lower jaw to prevent superimposition of the tongue's shadow to the atlas and axis. The central ray is directed to the center of mouth and perpendicular to the image receptor or cassette. It has a source to image distance of 40 inches or 100 centimeters. Another one, we have the lateral projection for the atlas and axis. The patient's position can be supine or erect depending on trauma. The detector is placed portrait, running parallel to the long axis of the cervical spine on the patient's left side. Then slightly extend the patient's head. The central ray is perpendicular, 1 inch distal to the mastoid tip. This position prevents the superimposition of the laminae and atlas.